Hey guys, welcome to our first webinar about the CAMTech Glocal Jugaad-a-thon. This is the first and the beginning of a long series of events, as well as a really great institutional platform that CAMTech, the Consortium for Affordable Medical Technologies, is building in India. And starting out with the hackathon, there's plans to also do innovation sandboxes, publicize their grants, their awards, also much more in India, to really work on building together a vibrant network and a community that's focused around medical device innovation in India. So Jugaad-a-thon is brought to you by CAMTech, which is part of the MGH Center for Global Health, and Glocal Healthcare is a partner that's helping organize and get this moving on ground. Now, just in terms of talking a little bit about CAMTech's background, so like I mentioned, CAMTech is part of the Center for Global Health at MGH, which is a network of over 400 physicians spread out globally. And they do a tremendous body of work across public health, across technology, looking at interventions in various parts of the world. CAMTech's specific mandate is to focus on clinical challenges, look at innovations, and focus on developing game-changing medical technologies. And one of the strongest mechanisms that it uses to do this is to use medical hackathons as a platform in which, through which you get collaborators across multiple disciplines to get together and to co-create disruptive technologies. And then, of course, there's an identification process preceding that, which is a clinical summit. I'll touch on that briefly, even though this presentation is largely going to be focused on the hackathon, or the hacking part of it. And then to get to the development and the market commercialization phase, there's also an upcoming accelerator program that will allow technologies to be able to go all the way through to the marketplace. The program in India especially is supported by USAID, so we're definitely very grateful to them for their support. And without going over all of their names, the website has an acknowledgement of all of the partners who've come together to make the CAMTech program a reality. Without naming each of them one by one, we just first want to extend a shout out to all of them to help give life to this program. So in terms of hackathon, really, this slide summarizes what hackathons are in kind of one slide. It's about, first of all, high-quality problem identification. So it's not just about getting together and building something, but to understand what the user need or the end-user requirement is. And there's definitely a very large focus on having the right context within which to build and innovate something new. And therefore, the model is one of co-creation, where you need clinicians, you need end users, you need entrepreneurs, you need engineers and designers, along with mentors, typically with 10 or more years of experience, who are guiding the process. And that's basically what allows you to create radically new ideas. So we're definitely very hopeful that all of the guys who are and gals who are applying to this for the Jugaad-a-thon, some with experience, some without, we have an interesting mix of applicants so far, will really enjoy for about 48 hours the ability to really go from concept to prototype rapidly. And even within those 48 hours, you would find that there's a lot of iteration, there's a lot of feedback that's incorporated while you're building out the prototype. So I've sort of covered some of the elements of the cross-disciplinary nature of teams that get together to hack. The other thing is that there's also the other benefit of being able to do this in a more controlled environment is that it's a safe environment. So there's room to fail, there's room to rebuild, there's room to change and pivot and try out new approaches to solving the same problem statements. The other thing that I'd just like to highlight before getting into specifics of this particular event is that this is, of course, not the first time that CAMTech is doing this. CAMTech's done hackathons across 3 continents so far, so India, Uganda, and the US. And so far, there have been over 1,000 participants, over 150 participating organizations, and over 100 innovations. And as you can see, both in terms of the mix of partners that have helped make it happen, as well as looking at technologies by clinical focus and innovations by segment, a pretty broad swath of technologies impacting different kinds of clinical problems have been chosen. One important thing, though, very specific to the program in Bangalore, we are focusing on what we're calling RMNCH. So that's reproductive, maternal, neonatal, um, child health. So basically looking at maternal and child health as the key focus area for the hackathon, which of course in itself is a very vast area. Just to give one of the questions we get often as organizers is, what constitutes a hack? What's a good hack? What am I expected to do? What's the weekend like? So this slide really summarizes the hackathon that Glocal organized in January 2014 in Calcutta, which is supported by CAMTech, which had 60 participants, 9 clinical challenges, and a total of 14 innovations. So the challenge areas, there was, of course, maternal and neonatal care. On top of that, we'd focused also on some emergency and critical care problems, as well as mobile health technologies. So the first prize, in fact, was taken by the team called NeedUma. They built a low-cost, easy-to-use device that addresses postpartum hemorrhage. So what I think was interesting as one of the observers to this process was, I think they really had a very sharp focus on the problem they were trying to solve. And also, they, in a space of a really short period of time, built an understanding of what users did, what skills they had. This was, of course, facilitated by mentors who were in the room to give clinical context to them. But they built an understanding of what resources are currently used, what techniques are currently used to manage postpartum hemorrhage, PPH, and then innovated around that to really what might seem like a simple sort of chemistry invention that potentially could have a lot of impact on stemming bleeding early on, which also wouldn't require traditional birth attendants to do a lot of, to change very much the way they practice. So I think their innovation was really, I think, in the sharp identification of the way in which their technology would fit seamlessly into the lives of those already taking care of postpartum hemorrhage traditionally in the Indian context. The second prize went to Baby Connect, which was sort of at the intersection of M-Health and maternal neonatal care, with a focus on a remote monitoring device that connected pregnant women through a fetal monitor and provided fetal monitoring with also broadcast facilities that could, the father could also get signals about what's going on with the child, for instance. The third prize was Catacam, which was a cataract diagnostic tool, point-of-care diagnostic tool. So that was in the M-Health category. Really looking to build the ability to screen early on people's cataracts for inclusion or exclusion into the surgical assessment. So basically something that would be a light, mobile, field-based tool that allowed you to do appropriate selection of patients to refer up to for further screening and eventual surgery. There was also a Best Presentation Award awarded to Pillbox, which is a low-cost pillbox that was focusing on the Indian market to ensure medication adherence. So this, I hope, gives you a sense of the broad swath of approaches, possibilities that people explored in the process of hacking, and this was back in January this year. Just a quick slideshow that hopefully gives you a flavor of what a hackathon feels like. There's a lot less of sitting down. There's a lot more of working, talking, a lot more activity around tables, and a lot of innovation and collaboration that goes on in those 2 days. Probably this is the slide all of you guys have been waiting for, which is the application process, the structure of the entire event in Bangalore, and what the key dates are. So the applications are running, the event is running from the 17th through the 20th of July. The 17th is the date of the clinical site visit. So the first day is the clinical site visit, which is basically focused on techies to get exposure to a hospital environment. So the idea is often if you're coming in to do a medical technology hackathon, you need to get some context for understanding what the for understanding how your technologies would fit into a hospital environment. The clinical site visit registration is actually included inside the Jugaad-a-thon application. So once you apply for Jugaad-a-thon, you'll be able to see there a choice to see if you are interested in the clinical site visit, and we'll be putting up details of the site visit locations shortly inside on the website. So up above are the links to the website. Most of the information that I'm covering here is also available online. The website is there. We're also on facebook.com/Jugaad-a-thon. So either one of those locations you go to, and if you need to just message us on Facebook, once again, or find us on Twitter, which is we are also at Jugaad-a-thon. So drop us a line in case you have any more questions after you've seen this presentation. Applications are due by the 7th of July. So we're expecting a total of 200 participants. So we definitely need to close out the applications a bit early so that we have time to debrief with all of the applicants and prep, do the necessary prep at our end to set things up. So we'd request you to put in your applications early, ideally by the end of June. We're also going to release a first cut of deadlines, a first cut of names by the end of this month, and then the final cutoff is on the 7th of July. So apply early, always better. More seats up right now. We're, I think, right now going in at about 2025 with another commitment of about another 50 more. So we're right now batting at about 70 out of 200. So we'd like you guys to apply soon so that you have better chances of getting a spot. The hackathon itself has an icebreaker. I apologize for the typo. It should reach 6 p.m. On the 18th of July. That's when the icebreaker starts. This is at the Alila Hotel. Once again, the exact location, including a link out to the Google Maps, is available in the contact section of the website. July 19th, 8:30 a.m. start. That's when the hackathon starts in earnest. This is at the GE John F. Welch Center in Whitefield, the Alila Hotel, where the icebreaker is also just about 2 kilometers away from the John F. Welch Center. And this is where I'd definitely like to acknowledge the support extended to CAMTech by GE in being the event hosts for the hackathon. So we are definitely very grateful to them and also for being such generous hosts. Now, we'll have to ensure that since we are going in a controlled campus, since we are going into GE's research center, that there's a number of security precautions and clearances that need to be adhered to. So that's another reason why we're asking you to apply early. We'd want to ensure that you get time to review all of the safety security protocols that you'll be asked to adhere to for the 2 days of the hackathon. You'll, of course, have over 20 mentors with cross-disciplinary expertise who will be available to you through the duration of the hackathon. And like I said, the focus is going to be on RMNCH, that's reproductive, maternal, neonatal, and child health. So that's what we have. We welcome you to Jugaad-a-thon, the next edition, which is going live in Bangalore from the 17th to the 20th of July. And hope you'll join us, and we look forward to seeing you there. Thank you very much.